Yuma, good morning everybody, and welcome here today to this very special launch and the next stage of a very big conversation in Australia about racism. I'm Dan Borscher from the ABC, and I'm really thrilled to be the Master of Ceremonies to help navigate this morning through the conversation about this special edition of the Lancet magazine that has got a whole range of discussions and contributions about racism and xenophobia from right around the world, including a not insignificant piece from right here at the ANU in Australia from the Micah Y study team and Engaged ANU around advancing racial and ethnic equality in science, medicine and global health. I just want to begin by acknowledging the traditional custodians of this land, the Ngunnawal people, and pay my respects to the elders and custodians past and present, particularly for the ability and the way of sharing ancient stories, the way that has happened across the ABC and that we've been able to amplify in the community. And I want to acknowledge other Aboriginal and Torres Strait Islander people here. And also, at times like this, I think about my own family's heritage. And I was thinking this morning about Nana Dalton and about how at the time when she was raising children in Melbourne, on the lands where my mum's connected to, she used to put talcum powder on their face to whiten them because such was the fear that those children would be taken away. And Auntie Josie used to talk about that and how the impact that had about how she used to see herself and about what that means when you look into the mirror and see back someone that looks different than who you know you are. And it's something that drives me in the work that I do in storytelling, and it's why I think it's so important that we have these very big conversations that bring people together. On that note, I'd love to welcome up Uncle Wally Bell, Ngunnawal Elder, to formally welcome us to his country. Please make him welcome.
We're going to start off with some tradition. Now, the Ngunnawal people, we've got several different clan groups and we move around on country a lot. And when we bump into each other, we always greet each other. I'm going to say a word to you guys, and you guys are going to say that word back to me with total enthusiasm. And I know you can do it. That word is Yuma. Yuma. Hey, come on, you can do better than that. Yuma. Yuma. Beautiful. See, I knew you could do it. That word in our language means hello. Now, if I was to nick off now, leave the place, I'd just say to you, yada. Which is goodbye. But I'm not going. To begin with then, Ngunnawal people, we've occupied this region for a scientifically proven at least 25,000 years. Now, that's the scientific evidence that everybody asks for, and that's been provided through some carbon dating they've done on one of our rock shelter sites called Birrugai. That word in our language means laughter, and that word is used to describe that place because on some days when you're up there at that rock shelter, if the wind's blowing the right way, it sounds like the laughter of our past generations. Ngunnawal people, we occupy an area of something like 17,000 square kilometres, which includes the whole of the ACT. So our boundary, if you want to call it that, is outside in New South Wales. And we've looked after that country now for all this time. And at least 25,000 years, and we know we've been here longer because of the fact that we moved in after the Ice Age went away, something like 35,000 years ago. Ngunnawal people then, we have different clan groups, as I mentioned before. My clan group are the Yar people, and we come from that area around Yass. But I actually grew up in a little place just outside of Yass called Jerawa. Not Jerawa. Yeah, there is a place called that, but this is Jerawa. In our language means running water. It's out there that I learned about being an Aboriginal person on country, as is our traditional customary practice. My dad took me out on country and showed me all about the place, where to look for food and water and all those sort of things, and gave me an initial grounding in being able to survive on country. So that's where my beginnings come from, and I can say that was a really great place to grow up in. I learned all about being an Aboriginal person on country, and that put me in good stead to where I am today. I do a lot of cultural awareness out on country, not only talking about our culture and the way it gets done and all that sort of stuff, but I also impart knowledge about some of our more traditional practices, in relation to traditional land management. One of those ones that I do a fair bit of is because of bushfires and all that sort of stuff. Sort of put the way that we manage the land in relation to using our fire management regime, our cool burning methods, has really come to the forefront. So there's a bit of a call at the moment to learn more about how we do stuff on country, and that's quite one of those things that shows quite a respect for us in relation to our land management practices. As our different clan groups and living on country together, we I guess operate under what would be labelled as something like communal law. So that means that we all get along together on country, and just like families, we're all family groups. So we sort of end up having a barney now and then, but that's just life. But with Aboriginal people, the normal Aboriginal people, we also operate under, like the rest of us, Aboriginal Australia, traditional customary law. Now that law then is quite significant wherever you go in Australia. Now, our all Aboriginal people get their customs and belief systems from the place that they're living on. So what we do here on country, in Ngunnawal country, is going to be quite different to even some of our neighbouring groups, like, for instance, the Yuin people. Now, Ngunnawal people, we get our customs and belief systems from the land and the big hills that we have. But the Yuin people, then they'll get their belief systems from the land plus the ocean. So straight up, you're going to see that cultural practice is going to be quite different between us and them. And that happens right around Australia because everybody's living in different environments, so you're going to have different cultural practice wherever you go. So that's an important phase that everybody should be quite aware of when they're travelling around in Australia. Because I know for a fact that some of the things that get done on, say, one group's country, if you try and do it on somebody else's country, it's going to be quite offensive maybe. So you've got to be quite aware of that sort of stuff. We all operate under, as I said, the traditional customary law. Now that law gets done in different ways. As I said, our cultural practice is quite different wherever you go in Australia. Traditional customary law is going to be quite different because it's sort of attuned to that customary, the traditional land management practices and all those sort of things. So ways of doing things in country are going to be different through that law. So one of the elements that everybody undertakes through that traditional customary law is a welcome to country. That's going to be done differently, again, but Even here on Ngunnawal country with our different clan groups, we have slight variations in the way that we do our welcome to country. Now, my clan group, the Yar, we not only welcome people onto country, but we also offer you a protection while you're here as well. So we're going to look after you to make sure that nothing happens to you while you're on country. What we're going to do is look after you in a physical sense, and we're going to look after you in a spiritual sense. So the physical part's going to be taken care of by what we call our spirit of the land. So that means as you're walking around on country, treading foot on country, having a good old look around on country, the spirit of the land's going to look up and look out for you to make sure that nothing happens to you in a physical sense. They're going to accept the fact that people are going to have slips and trips and stuff like that, but they're going to make sure that nothing really bad happens to you, well, to the best of their ability, because, some people do silly stuff out there, especially mountain bike riders. The other part then is the spiritual protection. Now, everybody here, you have your own personal aura. That's something you carry with you all the way through your life. And I guess you guys know all about those sort of things, so I really don't have to explain that. But under our belief systems, we know that there's bad spirit out on country as well. Now that is something you can't see or touch, but we know it's there. Now it does affect the land that you're on and you as a person, because it has a tendency to latch onto your aura and do something to you on the downside, make you, for example, sick or sad or something like that. So we've got to make sure that that stuff is removed. So we're going to call upon our past generations. So as Aboriginal people, we all have a strong belief in the fact that we all come from the land. We're placed here in the physical sense, and we're out, to look after the place, to care for country. And then when our time is up, we then go back to the land. Now, those generations now that have gone through that process, we call them our ancestral spirits. So they're the ones that we're going to call upon to make sure that any bad spirit that might be around gets removed. So I then have to make sure that those spirits are aware that I'm welcoming you guys onto country. So I've got to make a bit of noise and call for those spirits to come and join me. I'm going to play my clapsticks for that. Okay. My being a Ngunnawal man, and I do a lot of stuff on country. I have a really strong bond with my country. I can actually tell that those spirits have now joined us. Hopefully you can feel their presence as well. As I said then, the spirit of the land will now look after you as you walk around on country, make sure that nothing really bad happens to you physically. The ancestral spirits of ours are now going around to everybody here, looking at your auras to make sure that there's no bad spirit that might be attached to it. But if they do find that stuff, they just grab hold of it Toss it off country, get rid of it. Something we don't want here. We don't want it to affect you as a person, and we certainly don't want it to affect the land that you're on. The Spirit's then asked that you do two things while you're on country. First one, important one, respect this place that you're in. Look after it, care for it, as we have done now for thousands of years. Second thing they want you to do is also to respect and be kind and courteous to other people that you meet while you're on country. So if you do these two things for us, the spirits will then harmonise with your stay on Ngunnawal country. So may the spirits be with you today, tomorrow and for always. I'll just close off with some words in language. Darawa nunna, darawa Ngunnawal, yangu nalaweri dunamayan naraganawale. Yumalundi. This land is Ngunnawal land. We've all come together today for a very special reason. Welcome. John Yamaba, thank you.
Thank you very much, Uncle Wally, for that warm welcome, and also for extending that protection both of the physicality and the spirituality, and for your generosity in sharing the story behind that, of what that means, of how that comes to be. I think that that's really informative. And you talked about culture there. I was looking around the room and seeing Aboriginal and Torres Strait Islander people from right across this nation. I'm really looking forward to hearing so many perspectives throughout this morning. So thank you so very much. Please give it up for Uncle Wally Bell. Now I've got the boring bit of the morning, and this is the housekeeping rules. First thing is, if you've got a mobile phone, make sure that you switch it to silent at least now, or at least switch it off if you can, because you don't want to be that person whose phone starts ringing right when one of the elders is starting to speak. It's incredibly disrespectful. The emergency exits are located on the lower level to my left and at the top of the stairs. Once you leave the theatre, continue through the foyer next to the building through the main doors. Restrooms are outside in the foyer where you entered past the cafe. This event is being filmed, and recordings will be published on the ANU website after the event. We'll email a link to everyone that registered through Eventbrite. And if you need to leave, please exit and re-enter via the back upstairs doors there as a way of avoiding disruptions. Also, throughout this morning, we're going to have a panel discussion after a number of keynote speeches. You can submit your questions through the presentations using the Slido platform. So you can either scan this QR code here, so you'll need to have your phone on, but on silent, or you can go to slido.com and enter the code on the screen, which is 1843613, and we'll come back around to that a little bit later, but we'll leave that up for a moment. And you can submit questions at any time, whether in person or if you're joining us online this morning, as I know there are quite a few people who are. Those questions can either be to the entire panel or to one person specifically. Also, I understand that today these topics that we're going to be discussing will be quite intense and could cause sadness or also distress. So if you need to speak to someone about this, you can call 13 Yarn, which is 13 92 76. That's 24 hours a day, 7 days a week. And you can speak to an Aboriginal or Torres Strait Islander crisis supporter, or you can call Lifeline on 13 11 14. And I can come back to those numbers later on if anyone would like to find out what those are, either throughout or after the event. To kick us off this morning, I'm really keen to welcome up our first speakers, Professor Ian Anderson, a Palawa man, and Dr. Mabel Chu, who are going to talk about Lancet's commitment to racial and ethnic equity, editorial initiatives and also actions. Professor Ian Anderson is Palawa, is the ANU's Deputy Vice-Chancellor for Student and University Experience for now, although he's just got a great big fancy new job that he might touch on. In this role, he provides leadership on strategic initiatives that promote student and staff equity, Indigenous Indigenous reconciliation and also improve the quality of the student experience. He's also a member of the Lancet's Racial Equity Advisory Board. And Dr. Mabel Chew is a senior editor of Lancet, is a founding member of the Group for Racial Equity, known as GRACE, which advocates for the opportunities and resources needed to achieve racial and ethnic equity within and outside the Lancet Group. Dr. Chew is a fellow of the Royal Australian College of General Practitioners and has been working part-time as a general practitioner in Sydney since 1995. He's also been a lecturer in the Department of General Practice at the University of Sydney. Please welcome Professor Anderson and Dr. Chew.
Palangina, Pankana Ian Anderson, Palawa Trowana, Palawala Churicha, Chawalawe, Parabana, Katumine Mane Nanawu, Ngambri, Tiana. So in Palawakani, I'm just acknowledging that we're on the land of the Ngambri and the Ngunnawal people, and to thank you for your ongoing custodianship and the respect that you provide us all here at this university. I wanted to begin also by acknowledging not only Wally Bell as a traditional custodian who so very graciously welcomed us here to country, but a number of other significant Indigenous leaders in the audience. Dr. Professor Janine Mohammed as a CEO of the Lowitja Institute, Professor Tom Kalmar, my old colleague, Dr. Mark Winnetong, who just told me that for the first time he's actually retired from clinical practice, so that's been a lifetime of doctoring in the Indigenous world, and Professor Ray Lovett, who led the publication that he will be talking about later, and Dr. Chew from the Lancet. I wanted to really talk, and of course Rom, who's an old colleague and former CEO of the Lowitja Institute, and was particularly involved in a collaboration that I'll just very briefly touch on, Rom Mokak, sorry, in a little moment. So it was Indigenous activism, global activism, that actually started to drive the global journals, such as the Lancet, to engage in a more fulsome and respectful way in publication of issues, in this case, in Indigenous health. In 2004, at the end of the United Nations declared first Decade of Indigenous Peoples, the academic landscape in Indigenous health was significantly different than it looks today. There was, I think, only one Indigenous professor in health, that despite decades of Indigenous health research, the actual formal collaboration with Indigenous Australians in the development of health research was relatively new, and primarily led then by the Cooperative Research Centre for Aboriginal and Tropical Health, which later went on to form the Lowitja Institute after a number of 12 years. The publication by Indigenous people in the global journals, I think, was actually relatively rare, if at all had happened at all. There were certainly many significant non-Indigenous academics who published in those journals, but there were no Indigenous peoples from anywhere across the globe. So in the late 90s to the early 2000s, there was significant Indigenous-led activism that led to the internationalisation of these agendas. It was on the back of the UN work around the 20 years, I think it was over 20 years, in development of the Rights of Indigenous People Declaration, but it was much more focused around educational health systems. There are a number of processes that were led by governments, but also engaged by Indigenous academics and activists. For example, the Pacific Region Indigenous Doctors Congress was formed by Indigenous doctors across the Pacific. It was formed in the late 1990s. The National Health and Medical Research Council in Australia formed tripartite research partnerships between Australia, Canada and New Zealand. There was corresponding work between the Canadian, Australian and New Zealand health data system around building health data. Most of this was framed by government opportunities who were actually specifically leading to find ways to accelerate policy and practice development across mostly the Pacific jurisdictions, but progressively were taken over by Indigenous-led academic processes. So this is kind of a part of the context in which the Lancet really first became engaged in Indigenous health across the globe. There was a conference organised by the London School of Tropical Hygiene and Health in December 2004, which I attended along with other Indigenous academics and a number of community activists from across the globe, both North America, South America, the Pacific, Israel, Scandinavian countries, and so on. It was a clunky meeting. It was led by the London School of Tropical Hygiene and Health, which was very, with respect to the organisers, very colonial in how it engaged with Indigenous peoples. It grew out of a colonial system in which public health was really about how you manage the tropics and manage the native labour force. So it had that history in it. And even though the academics who were leading that were quite different in their thinking, they also divided the world into North and South. So we were organised into the northern jurisdictions, which frankly for me, being Palawa and coming from the most southern jurisdiction, and how for us we were the most southern living people in the world, in humanity, for most of humanity's history, we found it quite galling the way in which we were being organised globally in a kind of a colonial framework. But nevertheless, it provided a really significant opportunity for academics and activists to come together in ways to consider how to really drive the kind of international agenda in Indigenous health. Richard Horton came to that meeting, and Jeff Redding, on the behalf of us, who's a Canadian Aboriginal health academic, actually put a proposition to him that the Lancet would publish a series on Indigenous health for the first time. Richard is, quite an extraordinary leader, and he was very open to being hijacked in a meeting, and actually responded very constructively to the proposition, and that led to the first Lancet series, which was published in 2006, I think, on Indigenous health. It was, I led the Australian Pacific publication. There were others that covered Africa, South America, and I think North America. It was a very interesting experience for most of us. We hadn't come through the kind of the trade approach to being an academic. I hadn't finished my PhD at that point. We hadn't had the development opportunities where we understood how to publish in global journals. Most of us came from practice fields into the academy. So the whole series was a significant learning for us as people were writing for the first time in the global journal, and some of the articles had a really troubled history trying to get up to the publication standards that the Lancet expected at the time. The one from Africa was particularly controversial because most of the reviewers said we're all Africans, we're all Indigenous, we're all colonised. But the point they were trying to make is that for some peoples, the same people, and also the forest peoples of Central Africa, actually there's a longer history of colonisation. So I think for a number of us, it really was a significant learning experience, but I'd have to say that working with the journal, people were very engaged and respectful in trying to find ways to enable our voice into the journals. The global agenda subsequently shifted gears with the announcement of the UN Declaration of Indigenous Rights in 2007 and the latter development of social development goals. This really consolidated over 2 to 3 decades of Indigenous activism that was really focused at the United Nations. I note then that there was still varying degrees of resistance from member states, including Australia, in the 2007 agreement. But data, what's pivotal in that is that data became critically important. You can't hold member states or the countries across the world to accountability around their ability to progress Indigenous rights if you can't present them with data. Data is a fundamental part of the ability to measure and keep accountability to human rights. It's also around this time that the Indigenous data sovereignty agenda started to emerge, and really that started to really bring Indigenous decolonisation process to how you control, monitor and occupy the data world. Building on and challenging the kind of world of health data in particular. Sometime around there, the Lancet reached out to commission a further series on Indigenous health across the globe. This time working with the Lowitja Institute here in Australia as a First Nations-led Indigenous institution to build a more comprehensive picture of Indigenous health across the globe. I worked with 67 authors across 22 countries, working on Skype. That was our method. Nothing like the more sophisticated Teams or Zoom that we have today. So Skype conversations, which mostly fell over in about 5 minutes, and you spent half an hour trying to reconnect people and to continue a conversation. It was, I think, for me, one of the most challenging bits of research work that I have led. I'm very grateful for the collegiality within the Lowitja Institute. It was also not, I think we, and I'm very grateful for this, we received about $80,000 in funding to support the project. I would never do that again. But it was a real sign to how important all those other researchers held this project as a project for leading global reform. Across 22 countries, across all major global regions, there were authors in Africa, China, Southeast Asia, India, North and South America. It really pushed kind of notions of how you include Indigenous peoples from a whole range of very, very different historical contexts. Populations that have multiple layers of colonisation history, such as in Asia and in Africa. Populations in the Pacific which have more or less one or two single colonisation events. The other thing that was really striking in the whole process was the different capacities across the globe. New Zealand and Australia, we are relatively more privileged in terms of other Indigenous populations in the world. Now that seems sometimes a little bit galling in terms of our internal experience, but the capabilities are very different. That was challenging for us. There were groups which had no Indigenous authors because that was the state of development in those systems. We were working in parts of the globe where there were varying degrees of openness around Indigenous populations. I remember a long conversation in Yunnan around Dai populations where there was a series of exchanges going back over 3 months about the poverty rate amongst the Dai population in the Yunnan province. And I was kind of inclined to not believe that it was 0%, but they were in China. But it was finally when we got a Mandarin-speaking person that we could actually unravel that, in fact, they actually did have poverty in the Yunnan province. The issue of working in global collaborations when you don't have sophisticated ways to translate. I'm embarrassed to say, but we did use Google Translate on some of the more difficult conversations. Not a great tool, and probably I would never recommend it in the future. Nevertheless, we published this conversation, and that was probably a very significant moment in the history of the Lancet. I want to finish by making 3 observations about what the agenda is going forward and what decolonisation might mean in that agenda. First of all is that we need to see more Indigenous authors in the global journals, just full stop. But there is a pathway in which we need to progress that. We need the mechanisms such as the Racial Equity Board to actually guide and provide that governance and accountability for journals such as the Lancet. But we also need peer review systems. We need Indigenous reviewers. Now, that is not straightforward. It's not obvious when you're editing a journal in London who to approach in the Indigenous world in Australia. And it's not only just Indigenous academics, it's also Indigenous professionals. Journals such as the Lancet are really written for a health professional audience, so I don't want to be medical-centric. But it's important that those reviewers include Indigenous doctors and nurses who can actually translate and see the application of work into practice. That is probably a good job for the Lowitja, Janine, to help facilitate the development of those networks and capacities. I also think that there's a really fundamental, as I alluded earlier, in actually building the capacity of Indigenous academics. Now, some are coming through that have built that kind of writing credentials right from the PhD program. Wasn't the case in my generation. But I still think there is ways in which we need to upskill, develop and build the capacity of Indigenous academics to lead the publication into journals such as the Lancet. That doesn't happen particularly it can occur. It's not an unfathomable skill, but it does require practice, and it does require an understanding of how people like Mabel Chu think as an editor in a journal. So I think on that note, I'm going to hand over to Dr. Chu to talk through some of the initiatives that the Lancet is taking forward. So again, thank you, Wellbeing. Congratulations, Professor Lovett. I'm saying that because when I said Professor before, he said I'm still bucking the establishment. So welcome to the establishment, Professor Lovett. Again, my hearty congratulations to you. It is a magnificent achievement that you have led in getting this important work in a journal such as the Lancet. And you wouldn't have got any easy pass on this. You would have been treated in the same approach to academic rigour as every other author that the Lancet sees. So it's a really important moment for you and the research and for your team. So if we can just thank Ray.
Thank you very much indeed, Ian, for that historical context and a pointer to where things will go, might go, will go. And thank you so much, Uncle Wally, for your warm, generous welcome to country and the protection that you've given us. I'd also, on behalf of the Lancet, like to thank the ANU and Lowitja Institute for hosting this Australian launch of the Lancet special issue, Advancing Racial and Ethnic Equity in Health. And to thank everyone who's here in this room and online for joining us in this great event, because it's also very much to launch the Mai Kauayu study that Ray has led. It would not have been possible without the hard work, advice and encouragement of many in this room and online, including Ian. Ian's given the seeds talked about the seeds of how he started collaborating with the Lancet, and I'll take it up a bit more recently to discuss the seeds for this special issue, which were first sown by Delan Devakumar at University College London, who approached, again, there's a bit of a theme here, approached our editor-in-chief, Richard Horton, back in 2019 with the concern that racism was an overlooked, ignored issue across all society. And he proposed a series exploring its impact on health. Then came the events of 2020. The murder of George Floyd, the protests of the Black Lives Matter movement, now given greater voice, the effects of the COVID pandemic, particularly on people from minoritized backgrounds. These catalysed our own actions at the Lancet Group and led in 2020 to our anti-racism pledge to take action to advance racial and ethnic equity with far, far more vigour than we'd done previously. And this special issue was going to be part of that commitment. So September last year, we called for papers for this special issue, and this has culminated in today's events. This issue was published on December 10th, timed to coincide with World Human Rights Day. We received many excellent submissions, far more than we could publish, far more than we could publish in this issue, and you will see some of these submissions in ordinary issues of the Lancet and elsewhere in the Lancet family. We were guided by our Racial Equity Advisory Board, as well as other external advisors, on what to publish. We wanted to encourage papers from marginalised groups, papers that went beyond redescribing disparities and simple single-factor approaches to papers that were more solutions-focused, papers that took an intersectional approach to these complex, overlapping relationships and systems that can compound disadvantage. So the special issue has 4 research papers, including, of course, the reason we're here today, the cross-sectional analysis based on the Mai Kauayu study that Ray Lovett will discuss later. After peer review and revision, we selected this paper because in our call for papers last year, we had asked for, among others, metrics with which to measure racism. And this paper does so by providing a novel metric with which to measure how much interpersonal discrimination contributes to the burden of psychological distress in Indigenous adults. Pat Dudgeon and Ros Walker wrote a linked comment which said that the corollary of this is that we really need urgent, meaningful action by policymakers, service providers and individuals working in partnership with Aboriginal and Torres Strait Islander communities to close this gap in psychological distress. Michelle Khan and colleagues wrote an unlinked editorial that reinforces the need for metrics to measure not only the state of things now, but to measure progress and the effectiveness of our interventions, to discuss the challenges as well as giving concrete recommendations. We also wanted this series, this issue, to celebrate achievement and culture. And there are profiles of people with inspiring stories, one of whom is Yin Paradis, who many here will know. Yin also co-authored the series that I mentioned, which in a way almost kick-started the whole issue. It's a packed issue. I don't expect you to read any of that, and I'd encourage people to dive into it. Ray asked me to speak a little bit about some of the other content. I'll talk briefly about the Brazilian Indigenous Health Research paper, which looked at the impact of urbanisation on the cardiometabolic health of Indigenous Brazilians. This was a systematic review and meta-analysis, and it examined 46 studies, over 20,000 adults from at least 33 Indigenous Brazilian ethnicities. They found that obesity prevalence was 3.5 times higher in those living in urbanised Indigenous territories than in those living in lands with over 80% native Amazon rainforest. So that's 28% for those in urbanised settings, compared with 8% obesity prevalence in those living in traditional lands. The effects of urbanisation, deforestation, and destruction of the Indigenous way of life are associated, therefore, with an increased prevalence of adverse cardiometabolic outcomes. That's the conclusion of this study. And the authors say, ultimately, the survival of Indigenous Brazilian peoples, especially those living in remote, unconquered regions, depends on the preservation of the ecosystem and worldwide advocacy for the conservation of their land and Indigenous property rights. Now, I think that's got a lot of resonance for us here in Australia, and Uncle Wally's reminded us of that necessity as well. I'll also very briefly mention this cohort analysis, which found that among people diagnosed with primary brain tumours in the US, Black patients were more likely to have recommendations against surgical resection, regardless of clinical, demographic, and socioeconomic factors, suggesting bias in the clinical decision-making process. I'm going to very briefly touch on this series. The research in the issue adds to the huge body of work showing that racism is as pervasive in health as it is in society. The series builds on this, and it gives us a framework with which to hang all this. It tells us that racism and discrimination are fundamental determinants of health. This infographic, again, too detailed to outline here, but they try to, in this framework, conceptualise it, starting off with the individual, and that's the blue bit at the top, looking at the effects of discrimination on the individual. They then zoom out to look at the bigger picture, conceptualising it as a globe, with the outer layer being the spatial or environmental determinants of racism and discrimination. The yellow layer is that of institutions and systems, so that's health, education, legal and justice systems. And then at the core of it all, this red centre is that of structural discrimination, the two processes of separation and hierarchical power, which drives everything else. Separation is the process by which some humans think or see themselves as being different to others, and hierarchical power, where society is defined according to categories such as race and caste, affording privilege and capital and opportunities to some and not to others. And then they just pull out an aspect of the systems layer to look at particularly health systems and discuss all the drivers of inequity there. There are no easy solutions, but the series also sets out some important principles to guide our thinking and actions. It tells us that transformative action requires us to tackle existing systems of power. It tells us that action needs to be community-based, it needs to be multi-sectoral, and it needs to go across society. We need to use legal instruments and human rights law for a robust framework to challenge these power structures that drive inequity. All this demands action from all sectors of society, including healthcare, education, research, funding bodies, governments, and of course journals. And I'll just talk briefly about the Lancet commitments. The Lancet operates within structures of scholarly publishing that have perpetuated discrimination and inequities. From its beginning, the journal had a role in supporting colonial medicine and discriminatory healthcare practices, and we're working to improve gender, racial, and geographic diversity and equity in what we publish, in our editorial processes and policies, and in our own workforce. We've published a statement on offensive historical content, apologising for the offence and harm it can cause. We've established the internal group for racial equity that advocates for what's needed both inside and outside the Lancet. We've signed up to an international movement launched by the Royal Society of Chemistry, but it's called the Joint Commitment for Action on Inclusion and Diversity in Publishing. This is an unprecedented coalition of over 50 publishers. I've never seen this in nearly 25 years of working as an editor. Over 50 publishers and journals working together to minimise bias and accelerate research culture change. The Lancet has launched the Lancet Regional Health Journals, which are 6 open access journals based on the 6 WHO world regions, with editors and officers actually based in those regions. And we're revamping our editorial processes and policies. This involves many initiatives, including developing an inclusive language guide, because we recognise that language can be divisive, but that using respectful, inclusive language enables the people to whom the language refers to feel valued and empowered. Such language also reduces bias and fosters equity. It has great power. We continue to encourage submissions on the effects of racism on health. We seek fair representation of geography, gender, race, and ethnicity in both authors and reviewers. We expect that papers concerning minoritized backgrounds, concerning minoritized peoples include authors who represent those peoples, who are from those backgrounds. And finally, of course, this isn't just about the Lancet special issue, it's about a lot more than that. And I'd just like to end with some words from our editorial. To say that racism doesn't just affect a few groups. It inflicts a collective trauma on us all. But the corollary of that is that by lessening inequities and restoring justice, we can bring healing to society as a whole. The special issue outlines a path towards doing so for health and medicine. It's very much a beginning and not an end. And we really look forward to working with people in this room, online, in Australia and across the world to achieve this. Thanks very much.
Thanks very much, Dr. Mabel Chew and Professor Ian Anderson, for you for going through the process and I guess the depth of those conversations that have been had. Next up to speak specifically about some of the content that's included from Australia is Professor Ray Lovett, a Nyampa man from the NHMRC Research Fellow and Director of the Maikuai Study at the National Centre for Epidemiology and Population Health here at the ANU. Ray's a social epidemiologist with extensive experience in health services research, large-scale data analysis for public health policy development and evaluation. Please make him welcome.
Thanks, Dan. I'd also just like to echo the appreciation for the welcome this morning by Uncle Wally, including that spiritual protection. and extend that to people online as well. I won't go through the title. Obviously, the article has a very long title. There's a lot of authors, but it was very pleasing, I think, this is one of the first instances where we haven't had to argue with a journal about including our tribal affiliations with our names. So appreciation there to the Lancet. So I'll just go through, hopefully I'm going to speak for about 7.5 minutes, why we did this work, what we found, and what that really means. So for us, it's really important. What sits behind MyQI and the study is a very strong and foundational Indigenous governance. Now, that consists of 3 different parts. So we have our MyQI investigators and partners that we've had in place. Lots of those people are in the room today. That has really guided and directed the work that we do in the study. Then we have our Thiru Thame reference group. That consists of Aboriginal and Torres Strait Islander people from all over the country, and it's a bit of a check on our work that we do across our, not just MyQI, but the whole program of work that we have in our centre. And some of those people are really good at telling us when we're doing the right thing and when we're doing not the right thing. So we appreciate both of those aspects. Then, in the spirit of Indigenous data sovereignty that Ian mentioned, we have a really robust and strong Indigenous data governance committee that sits behind the study as well. And even as the study director, I have to make application to that committee and meet those Indigenous data sovereignty principles for the work that we want to do, including this work today. Of course, that's what guides and directs us, but it is the inequities that the previous speakers have talked about. And we must address this story around how these inequities come to be. And we must therefore acknowledge that they are a process and consequence of settler colonialism and racism. I was here last night with Auntie Pat, and she calls it out pretty straight as well. I also have to often speak at these events and make this statement. I shouldn't have to, but I will every time, that race is a social construct, not a biological one. Therefore, in a world without racism, there would be no difference in health and wellbeing. And really that comes about from social structures and social systems. Racism and its impacts are often not recognised by non-Indigenous individuals and structures, and therefore not reflected in policy and laws. Our goal in this work was really to show how big the impacts of racism might be within Australia. So the MyQI study, for those that don't know, of course it's named in my language, Nyampa language, and it means to follow people over time. It's a longitudinal cohort study, so quite an apt name. It was very deliberately designed by and with Aboriginal and Torres Strait Islander peoples right across the country. And that was a period of 4 years that we undertook to develop that study. I know Janine will make mention of this later, but at the time when we were developing this work, and Ron was a big part of this, it was very hard for us to get funding from health and medical research for this work because we were very much focused on looking at the links between culture and wellbeing. Quite different to looking at risk factors, although we did want to collect a lot of new risk factors that we thought would be impacting on our health. We worked with community members to modify a measure of interpersonal discrimination. So that's one of the exposure measures that we have used in this work, and we've undertaken a process of validation about 12 months ago. So that same work was published because unfortunately, one of the first questions we get in our work is, how do you know you're measuring what you're measuring? So we've become very good at psychometric validation as well. At the moment, we have over 10,000 participants in Wave 1, and including the new Wave 2 survey that we've sent out recently, we're sitting at around 12,500 people at baseline with some follow-up. We've managed to weight the data to the total Aboriginal and Torres Strait Islander population, so you'll see that's what we present today, based on national population benchmarks that we've got from census. So that means we can say a much bigger story about our 10,000 participants in this analysis. What would that look at the whole Aboriginal and Torres Strait Islander adult population today? So these are the measures that we used in the Maiakawai study. They look pretty basic, they are pretty basic, but they really work. So we've captured 8 experiences of what we call interpersonal discrimination in the Maiakawai study. And then we've classified interpersonal racial discrimination if any of those experiences were reported by participants because they were Aboriginal or Torres Strait Islander. Now, it's really important that I emphasise that this measure does not capture all experiences of interpersonal discrimination. Potentially, we're just talking about the tip of the iceberg here. This measure does not capture structural forms of racism or any other forms of racism that Mabel's outlined in terms of the diagram earlier. So we don't yet have the data required to measure structural racism, but we're sort of working on some things around that as well. So here we're only talking about these experiences for people. So we estimated how common interpersonal discrimination and interpersonal racial discrimination are in the total Aboriginal and Torres Strait Islander population. Then we looked at the relationship between discrimination and an outcome called high or very high psychological distress amongst those participants. So we measured psychological distress using a culturally modified Kessler-5 score. We also validated that measure as part of our study because, again, the same question gets asked. And we did this because mental ill health is one of the leading contributors to the total burden of disease within the Aboriginal and Torres Strait Islander population, so it's a very important area. We calculated how much of the total burden of high to very high psychological distress is experienced by our population that could be caused by everyday discrimination. So we say could be because of the way we've used a population attributable fraction to do that. That also allows us to measure how much of the gap in psychological distress prevalence could be caused by everyday racial discrimination as well. We calculate how big the contribution of interpersonal racial discrimination would be under the hypothetical assumption that all of the observed discrimination-distress relationship is causal, going back to my point before about this being a social construct. So this gives us a robust upper bound on the size of the impact within these 8 measures. And again, I have to emphasise we're only talking about these 8 measures, which will really underestimate the total contribution of racism if we're only talking about these 8 things. The big thing for us is that we want to argue that policy action shouldn't wait until we have this strict evidence of causality. We need evidence to underpin action now. So what we found, 2 in 3 Aboriginal and Torres Strait Islander adults, or 65%, have experienced any of those 8 types of everyday discrimination that we included in the study. High or very high psychological distress is almost 3 times as likely amongst those who experienced any compared to no everyday discrimination. Everyday discrimination, therefore, could potentially explain up to half of the total burden of high to very high psychological distress in the population. That's quite a large amount. What this means in reality is that 74,000 Aboriginal and Torres Strait Islander adults may be experiencing high to very high psychological distress caused by everyday discrimination. That's 1 in 6 adult Aboriginal and Torres Strait Islander people in this country. When we look at the gap in levels of high psychological distress between Aboriginal and Torres Strait Islander people and non-Indigenous people, everyday racial discrimination could explain up to half the gap in high psychological distress, half again. What that really means, though, is that if we eliminate everyday racial discrimination, we could hypothetically halve the gap in the prevalence of high to very high psychological distress in this population. Again, very large numbers you don't usually see. But what does it all mean, really? So for us, in the work that we do, and I hope the rest of society, the harms of discrimination and racism must be recognised. We can't ignore this stuff. Tackling racism is a necessary first step in improving Aboriginal and Torres Strait Islander wellbeing and in closing gaps, if we are to close gaps. It reinforces imperatives for action against racism. And thankfully, all governments have committed to work in partnership to eliminate racism under Priority Reform 3 in the revised National Agreement on Closing the Gap. But it's multi-layered. I think Mabel made that point as well. So we need action against interpersonal discrimination between people every day. And then we need to address the broader system of racism that reinforces itself constantly. So that requires individual and structural change. We need accountability. I'm a big fan of accountability. For example, to measure, monitor and evaluate the impact of strategies to combat it. But also the 10,000 stories and the population more broadly that we're talking about today, we really need to figure out how to support ourselves as Aboriginal and Torres Strait Islander people. This stuff is harming us. We don't have to address it ourselves. We need this structural reform to help us. And the work, as you'll see in the video a bit later on, of all of this, has to be done though by those who have benefited from colonisation. And all action needs to be directed by us. So we need to drive, you need to do the work. I'll finish it there. Thanks.
Thank you very much, Professor Lovett, for that presentation and the work that you've been leading. I think the two things that really jumped out to me are the causal effect of racism on all the other health implications and the great risk of the status quo and of not the whole community and society not doing the work on that. Next up is Adjunct Professor Janine Muhammad, a proud Narungga and Kaurna woman from South Australia. Over the past 20 years, Janine has worked in nursing management, project management, research, workforce and health policy in the Aboriginal and Torres Strait Islander health sector. Janine has been based on Wurundjeri country in Melbourne since 2019 as the CEO of the Lowitja Institute, Australia's National Institute for Aboriginal and Torres Strait Islander Health Research. Please make her welcome.
I'm going to start by doing something a bit off script. We've all been sitting for a little while, so in the self-interest of me and that you're going to concentrate, how about we all just stand up for a moment while I centre myself? Move our bodies. You all needed that, right? So good morning, everyone. Of course, I would like to begin by paying my respects to the Ngunnawal and Ngambri peoples on whose lands we're meeting today and where I got to live and work for 15 years. So thank you, Uncle Wally, I think he's left, but for that beautiful welcome. I also pay my love and my respects to elders past, present and future emerging generations for whom our collective work is so important. And I stop and I pause on that for a moment and just reflect on what Ray said, because I hope my grandchildren aren't standing up here talking about how to combat racism, that they're talking about how we actually eradicated racism. You know, what a huge idea. But I also don't want my children to be talking about racism because it's not an easy subject to talk about. And it's constantly, often, Aboriginal Torres Strait Islander people standing up here talking about it because we're the most affected by it. So thankfully, we're beginning to see change and we're having non-Indigenous allies walk with us. Can I please also acknowledge our distinguished guests and also the ANU, the Mirakwai Study, Lowitja and Lancet teams for collaborating and bringing us together today. As Dan said, I'm a Narungagana woman. This is my home. I grew up in a little place called Point Pearce Mission in South Australia, and I am the CEO of the Lowitja Institute. And I'm also very pleased to be a co-author of the paper you've heard about from Ray. I thought it would be really important to speak with you here today at this special launch of the Lancet, special issue, about some of the implications of the paper's work and also about the work of the Lowitja Institute, what we do and how we've developed some resources which we hope will go some way to combating racism and lead system-level change. Oops. So the Lowitja Institute, and I can't go any further about talking about the Lowitja Institute without acknowledging Professor Anderson, who played obviously a very large role in bringing us all here today, but who actually played a very large role in the success of the Lowitja Institute. And I also acknowledge Romley here today, my predecessor. So Lowitja was established in Darwin. It was more than 20 years ago now, because Aboriginal Torres Strait Islander people had largely been locked out of the research process and we were othered. So non-Indigenous people did research on us and about us, and it was not by us or for us. And this meant that it was embedded in what we call the deficit discourse, where we were the problem. And I'm sure many Aboriginal Torres Strait Islander people in the room have heard the problem with Aboriginal Torres Strait Islander people as opposed to the problems we face. So rather than turning that gaze onto the systems that have caused us such harm, and of course the research narrative itself caused us such harm. We had medical experimentation carried out on our peoples in the name of research, and long-term issues of having non-Indigenous researchers coming into our communities, taking our intellectual property, never to be seen again. So there was no benefit for us. And it's no wonder then that we're suspicious of research and researchers, as Anipat so eloquently put last night. The Lowitja Institute has turned that around now, challenging and disrupting Western models of research and the power instilled in mainstream research organisations and the large pools of funding. And in doing so, it's changed the narrative of how research in Aboriginal Torres Strait Islander communities is commissioned in this country. Our grants, as many of you would know, this is our footprint here on the slide of just our last year of major research grants. And many of you will know that traditional research approaches put that emphasis on university-led teams with, track records. And of course, we were locked out of that. But we privilege our mob, we trust our mob, and especially so since 2 years ago, we actually became an Aboriginal community-controlled organisation. As a result, our funded research projects are 100% led by Aboriginal Torres Strait Islander researchers, and 100% of the funding goes to Aboriginal community-controlled organisations. This is a bit of a comparison. So compare that with the less than 10% of funding by the NHMRC into Aboriginal Torres Strait Islander health issues that were led by Indigenous researchers, and this is in the time frame of 2010 to 2016. Yet, of course, it's organisations like the NHMRC and ARC that holds the purse strings to the bulk of the money going into Aboriginal Torres Strait Islander health research. And importantly, also to our discussion here today, our worldview on research is different. Western models of research revere those medical models and methodologies and priorities, whereas we revere our ways of knowing, being and doing. We know research needs to be led by Aboriginal Torres Strait Islander researchers, and it must have knowledge translation baked in from the very start, thinking about the end user from the start, to make sure it translates meaningfully to our mob and that it directly benefits them. And of course, that it's not just tucked away in a medical journal and sits on a dusty shelf. So meaningfully, that impact and the knowledge translation is what we want to happen with this paper in the Lancet edition. And it needs to happen from the very source of racism, which, as we've heard, is power. The people who have the power are the ones who have to take the leadership here. It's not to say that Aboriginal Torres Strait Islander people are powerless, but often we are not in the positions of power. So what needs to happen? We've heard a little bit about this already. What needs to happen in response to this important publication? Well, as many of you will know, all levels of government in Australia have committed to work in partnership to eliminate racism under the Priority Reform 3 of the National Agreement on Closing the Gap. So we're calling on governments, policymakers, organisations and individuals to honour the agreement and to make real change. We want them to understand the prevalence of racism, to understand what racism feels like, sounds like, and most importantly, what it does to us all. To commit to concerted action to address racism at individual, institutional, community and structural levels. Because the evidence is here, it's in this study, and it's as loud as a bell. And it's clear to those of us who work in health how unsafe our health system is for all of our people. And the names of those harmed by that system rings out for us. This is Naomi Williams. She was a 27-year-old Wiradjuri woman who was 22 weeks pregnant with her son when she died of septicemia at Tumut Hospital in January in 2016. The coronial inquiry into Miss Williams' death found that she went to hospital 15 times in the months before she passed away without receiving a referral to an expert once. Miss Du, a 22-year-old Yamatji woman who died in custody in WA in 2014 because of deficient medical care. The coroner found that both the police and the hospital staff were influenced by their racial bias. These were both preventable deaths. Today's publication also tells us what is possible when Aboriginal Torres Strait Islander peoples determine our own research. What can be achieved through hard-won trust and valuable allyship. It tells us what we need, and that is an Aboriginal Torres Strait Islander research agenda that is well funded and supported by governments and funding bodies. And that we need greater investment into the Aboriginal and Torres Strait Islander research workforce. We need more black academics, and to grow and enhance our workforce in numbers and capability. That's a priority for us at the Lowitja Institute and a focus of much of our work, because the mainstream research agenda is also shaped by the ongoing effects of colonisation and, of course, racism. And it's important to note that mainstream research funding bodies did not step up, as Ray said, to support the Michael Wise study. They didn't realise or understand what Ray was trying to research, but the link between culture, health and wellbeing for our people, it's something that we've long known about. That mainstream understanding of our knowledges is beginning to change. We see that with the publications in this edition of the Lancet, and with Ray now, as I understand it, having access to mainstream funding. But it starts with organisations like Lowitja, yeah, I smiled, I was a bit cheeky, and highly skilled researchers like Ray, and allies, of course, like Catherine, who is first author on this paper. And a strategy for racism and a report card. And we need action at the individual and organisational level. And I'm pleased to say that the Lowitja Institute has developed a range of tools that enable action in response to our paper at multiple levels. We've developed a number of cultural safety products that you can see here on the screen over my next couple of slides. These products have been created to support non-Indigenous researchers and their organisations to provide culturally safe environments where our researchers work. That includes our tools for non-Indigenous individuals and organisations to audit themselves and their systems about their position, their journey on cultural safety. From here, we invite our organisations that are partnering with us to use our planning for cultural safety tool. So everyone knows what a reconciliation action plan is. This is kind of like a plan for anti-racism. And it also has a program logic element to it, so you can assess your outcomes and your progress and your impact, of course. One of the activities we then encourage our organisations to include in our plan, is our online allyship for cultural safety training. And if you're into evaluation, we have 6 tools to help you begin to do your evaluations in a culturally safe way. So what do we need in response to this groundbreaking work we are launching today? Well, in summary, and I've said it, we need planning, but we also need data collection, and I'll leave that to Ray and the team that know a lot about data governance and data sovereignty. But whatever we do, we have to measure the impact. We need more research on racism, of course. We know that we're only at the beginning of this journey, yet globally, people are far in front of us. And not to mention, we need great decolonised journals to publish this work. And wouldn't it be great, I think, to have an update of the Indigenous and tribal people's health? I think that we could probably get more money, Professor Anderson, and we could potentially do it on Zoom this time. But we also need, we need actions from governments on their commitments to address racism. Funding and focus for Aboriginal Torres Strait Islander-led research and researchers, culturally safe organisations, institutions, and of course our colleagues. And well, there's so much more. And of course, we all know in this room, there is no one silver bullet other than to say, yes, this is a social construct and anti-racism begins with us.
Thanks very much, Adjunct Professor Janine Mohammed, for the work that you've been leading for that presentation. The Cultural Safety Initiative and Allyship particularly jumped out at me, but I couldn't go past the black academics. There's so many of them here in this room that I could see your eyes darting around. Thank you so very, very much for that presentation. We've got a film next, Ending Racism. This video was created by the Maikuai study team and Engaged ANU and captures the stories of Maikuai study ambassadors and partners.
Racism is shit. It's silencing.
Racism makes us sick.
I don't think people understand how much racism breaks our spirit. We have to armour up every day when we leave our house and, we go into spaces where we're not safe. It's tiring and it's mentally exhausting, and that has huge impacts on our wellbeing.
It's impacted my family's lived experience. It's impacted the way they were cared for. So when I talk about that, people forget that it was not ancient long ago. It's really complex and it's really deep and it's ongoing.
Racism takes away opportunities that rightfully should have been there. So if I think about my grandparents, through racism, they weren't allowed the opportunities that mainstream Australia received.
For me, racism is unjust. It's wrong, it's hurtful. We know it's intentional and designed to not only oppress and suppress certain people, but it's disguised in many different ways.
Racism is
harmful and it's traumatic and it's bullshit.
It's a physical assault on your body.
Yeah, it's violence. It's traumatic and it's heavy. You feel it in your chest and you carry it around with you.
Racism is traumatic, destructive and divisive. No human being on this planet would want to tap into those emotions, yet we as Australia live in that environment every single day.
Blue sky thinking, a world without racism for me is having a world where culture is front and centre. And that's Aboriginal and Torres Strait Islander people and non-Indigenous Australians as well, and all types of people. It's about how people feel. And that process of not having to feel pain, I think, is what we're trying to get to. We can talk about the end goals, which I think we need to, but I think the process of living without pain is what the world looks like without racism.
A world without racism would mean my kids can go safely outside of our house and not have to feel like they don't belong in their own country. It means we don't have to armour up when we leave our house.
It means that my kids know their language, that our ways of knowing and being is centre. It's not been silenced.
If we didn't have racism, we'd have less mental health issues, we'd have less trauma, and we could just grow to be who we're meant to be.
It'd be lighter, like, you're not carrying this bag around on your back. You're not being this shapeshifter. You can just be yourself.
Free from the burden of what it is, the heaviness of it.
Yeah.
Harmonious, happy.
A world without racism would be a lot easier to navigate. Wouldn't be perfect. We all face challenges, but it would be a world where we didn't have a feeling of our backs are against the wall.
A world without racism would be freedom. It would be dropping the chains that, hold us back, and we would be able to thrive. And yeah, it'd be bloody deadly.
And freaking productive. Can you imagine how much time you'd have on your hands if we weren't having to deal with all of the shit that we have to deal with all the time?
A world without racism for me would be my future children knowing who they are and being comfortable in who they are.
It's not unachievable either. I think it is something that we can and should be working towards, and I'm not here to have a world with a little bit of racism. Like, I'm here to have a world with no racism.
Whew. Big question. Big question. To get there, it can't just be a ground-up sort of approach. It has to be all different ways. It has to be top-down. It has to be laterally with allies. I think we have to be brave and be bold. And to address colonisation, in my opinion, is to address racism directly.
It has to be real, genuine conversation around getting down to the truth of the effects that it's had on our people.
Education is where we can, seeking to understand somebody, rather than me saying, hey, you need to know that we are the rulers of this land and so forth, and people taking that in a way where we butt heads, but more so, hey, this is what we're about.
We get there by everybody doing their share of the work. It's work. It's hard work. And I know we're doing our share of the work. And I think the action needs to be, like, it can only be driven by us. And I think, I hear a lot about, mob getting a seat at the table, but I think we're beyond just a simple seat. We need to be the ones that have made the table and have decided who's at the table. And
there's 10,000 voices. We're all saying the same thing. No one can discount it anymore. So I think, yes, it is timely. And now with the data behind it, to actually say, well, here is the strategy, this is the solution.
I think, there's a lot in terms of power imbalance in this country. Non-Indigenous people, they may not be aware necessarily of that power and that privilege.
Well, I think it's also about being able to hear with an open heart and an open mind too. Walk alongside us, you know, and do the learning with us.
We want you to come into the conversation and say, was there something bad that actually happened? Educate yourself on it. And you can say, was it good or bad? And once you say that was bad, then what can you do as an individual to create change where it becomes good?
I think it needs to be something that all Australians address at the dinner table, at the pub, if you're on a bus, being a good ally, and then also voting yes in the referendum is also a bigger one.
To non-Indigenous people, I think the time has passed. We've been talking about this for too long, and it's on you to make a change.
It is hard work, but I guess just know that, like, we're behind you, we're beside you, we're in front of you.
How I would want a non-Indigenous person to change the system would be to encourage minorities, or in our case, Indigenous people, encourage them to get into those positions of leadership, because it's through them that the whole system can change.
Please give them a round of applause. What incredible work there, Ending Racism, by the Maikawai Study Team and Engaged ANU. And can I just say thank you to all the participants who shared their voices and their stories in that video. I do appreciate how tough it can be having those conversations. It felt a little bit like you can't ask that, but flipped around, of that we can't not hear this. This has to be part of the conversation that we're having nationally. It has to be the centre of it. We're going to have a live polling exercise now via the Slido app. So this is the same one that you can use for submitting questions for the panel throughout the launch. The checkup, and I think we might just try and get the QR code up. Oh, it's up there again for you. It's like a regular health checkup that can track how we're going with our health and wellbeing. This checkup is designed to help us reflect on what we're already doing and what more we could do to help eliminate racism towards Aboriginal and Torres Strait Islander peoples. It's not intended to be an exhaustive list of everything we could do, but rather a series of prompts that may help guide ongoing efforts, how we're sharing and where we're going from here. We're going to share 3 examples of items from the checkup for organisations as well. The Maikawai Study Team is also developing a checkup for actions that individuals can take to end racism. There'll be printed copies of each checkup available for each of you as you exit the theatre this morning. And we invite you to take multiple copies so that you can share them with your family, friends and colleagues. The checkups will also be hosted on a website, and the QR code will be printed on the copies as well. The responses will be aggregated and shown on screen, but they are anonymous and names will not be connected to the responses. So the first question is, my organisation has Aboriginal and Torres Strait Islander staff in leadership positions. And you can see as that data's starting to come through, those numbers will bounce around a bit, but clearly the overwhelming component is towards the positive end there, although some there with 6% seemingly zero, 14% with very minimal as well. Some of the comments there, haven't thought about it till now. That's how my organisation rolls, which I think probably highlights some of the challenges within some organisations. But certainly based on that, some encouraging data that's coming through there, although you would expect that, I imagine, from lots of the teams that are coming through here, and I guess it's probably important to note to think about your organisation as a whole. And so if you were at the university, for example, about the whole university, not necessarily just the team that you're in. We might move on to the next question now. My organisation has disciplinary action for racism. You all jumped ahead of me there. And so I imagine for Professor Lovett and the team, this will be really interesting that so much is sitting right there in the middle. I don't know how to assess that, so I'll leave that to others to consider what that means and what that looks like. And the final question, my organisation prioritises purchasing from Aboriginal and Torres Strait Islander businesses, so really looking around procurement and where spending is situated, which we've had a big focus on in recent years as a pathway to being able to create sustainability in an economic sense and the flow and effects that can have as well. So we really just wanted to provide that as a way of having a real-time sense of what that looks like for those people that are here in the room and joining us online. And excuse me, and about the impact of that and the way that those numbers can then be considered as part of the broader scope of conversation of the Maikawai study. Next up, we're going to have a panel discussion. So as you're finishing that off, I want to welcome up our panellists. Professor Tom Kalma, AO, is an Aboriginal elder from the Kanarakan tribal group and a member of the Lowitja tribal group, whose traditional lands are southwest of Darwin and on the Coburg Peninsula in the Northern Territory of Australia, respectively. He's the Chancellor of the University of Canberra, where I must acknowledge that I sit on the council under his leadership, a professor at the University of Sydney and the National Coordinator for Tackling Indigenous Smoking. He served as Race Discrimination Commissioner from 2004 to 2009 and Aboriginal and Torres Strait Islander Social Justice Commissioner from 2004 to 2010. He's also a member of the Referendum Working and Engagement Groups. Please make him welcome. Fiona Cornforth is a Wathathi woman of the far northeast Cape of Queensland with family roots also in the Torres Strait Islands. She joins us as CEO of the Aboriginal and Torres Strait Islander Healing Foundation and newly appointed chair of the National Health Leadership Forum. Fiona raises awareness about the need for intergenerational healing, not just the power and strengths of First Nations peoples' cultures for healing, but how all Australians must have a role in ending trauma experiences. Fiona has gained experience and perspectives in education, leadership and business development globally, and shares a message of celebration and gratitude for the greatness of ancestors, elders, and the ontology and authority that holds her and her family. Please make her welcome. Professor Peter Yu is a Yawuru man from Broome in the Kimberley region in northwest Australia with over 40 years' experience in Indigenous development and advocacy in the Kimberley and at the state, national and international level. Peter was a key negotiator on behalf of the Yawuru native title holders and the Western Australian State Government over the 2010 Yawuru Native Title Agreement. He was recently Chief Executive Officer of the Yawuru Corporate Group and is the current inaugural Vice President First Nations at the Australian National University. Please make him welcome. And I also want to welcome up three of our earlier speakers, Professor Ray Lovett, Dr. Mabel Chew and Professor Ian Anderson. Please make them all welcome as well. And I just want to remind you that you can submit questions for this panel, for anyone in particular, or for the whole panel by using that same Slido app. There's an option there to submit your questions where we'll have a team looking at those and really triaging those so that we can try and keep this conversation moving forward. But I want to start with one question for all of the new speakers, and I'll start with Tom. And then go through the part of the panel, just on what were the key takeouts and importance of the research and this discussion that we've seen in the Lancet today.
Oh, thank you, Dan, and can I also acknowledge the Ngunnawal and the Ngambri peoples and thank Wally for his welcome to country. Look, I think the report is very important, and it's one that you know, as has been described, has a very strong database, and it's reflective of what's happening across the nation. So it's really important. The two elements to it, and we'll touch on this a bit later, I guess, is one is the interpersonal impacts of racism and discrimination, and the other is the structural impacts and what needs to happen. So I think it's so important, and it's also an opportunity for us to reflect on our own positions on racism and discrimination. And I guess from a human rights perspective, we always say that racism starts with me. So if we can personally address racism and not be perpetrators, then that's going to go a long way to eliminating racism. And that really does come into addressing personal biases and what influences us to take positions that we might take about people.
Thanks very much, Tom. Fiona?
Yeah, we're at a point now with the Healing Foundation where we talk to a lot of parts of the system and workforces and sectors about what it means to be trauma aware and healing informed. And that's where we're at, because once we mention the R word, people close up shop still. So the more, it's so important that these papers come out and discuss it and talk about the prevalence, the extent and the impact, because then it's there. You can't deny it anymore. You can't pretend it doesn't exist, and you've got to do something about it, hopefully. I loved how today a lot of the speakers talked about the solutions, because I was sitting there thinking about some of our other work in schools, and this is all survivor-led healing, right? And so we've developed resource kits for school students, because survivors see them as the future of our workforces, right, and our sectors and their systems. And we have so much wonderful feedback from communities across the country. It's our most downloaded resource, but you have these beautiful stories of young people saying, claiming survivors, saying, that's my uncle now too, non-Indigenous children, saying, can I be your nephew? I'm your nephew, So, and that's just one of many. I love that despite our minimal funding, despite the restraints about our impacts, thanks to language and thanks to how early we are on this journey as a nation, there's those bright sparks to build on as a country.
Thanks, Fiona. And I just want to mention that if you are looking at the Slido app, you can also give a thumbs up to questions. That might be one that you're thinking of, and that'll push it up as well, just in case you're wondering what the little thumbs up on the right-hand side are for. Peter, what did you take out of what you've heard?
Well, I mean, ironically, as an Aboriginal person, nothing necessarily new, but obviously very critically groundbreaking in terms of its focus and its ability to get attention. But I'm really interested in the structural issue. I mean, if I was to ask the question here, who knows about the doctrine of discovery? Who knows in the room here about the question and online about the establishment of the Australian Federation and the Constitution? Who knows what Clause 25 of the Australian Constitution currently says? Who knows about the fact that the 1948 apartheid regime was borrowed from the Australian legal context? So the reason I mention that is that because we're not talking about history. We only had a huge debate on the Racial Discrimination Act amendments in 18C. We also had the Chief Legal Officer, the Attorney General of Australia, George Brandis, say that, that we're allowed to be bigots. We've also had, contemporary stuff. So we're not talking about history. That's why the structural thing is important to me, because governments do have a role, and institutions have the agencies to be able to address this issue, because it's an illness, an insidious illness that affects society. And the question is, who do we as individuals collectively want to see and understand the nature of what our soul is as a country? And particularly today, as a First Nation economic country, there's certainly no incapacity to be able to deal with this, whatever the kind of methodologies through the absolute research that's been done at the moment with Ray and all the members of his team. But it has to be a concurrent endeavour and effort by governments and corporates and the community leadership to deal with this, because racism is not going to go away. Still haven't found a cause for cancer, and racism is a core part of what cancer is in our society.
Thanks very much. I want to come back around to that point around structural racism in a moment, but first, Ian, there's a question that's come through here. How can we respond to organisations, this question has in brackets particularly governments, who see, quote, anti-racism as divisive or abrasive and prefer ideas such as cultural competency?
So I was reflecting on that. I don't know who chose that question, but actually that's a fabulous question. I was actually reflecting on that in part of the Close the Gap agreement, and some of the challenges of working with some governments who are quite conservative and, frankly, neo-colonial, as was the government I was working for at the time, very professionally, of course, but and just what a challenge it was to get in the Close the Gap context a measure of racism. Now, I'm really delighted that they finally got there, but it was an incredible challenge, and in some ways it sounds kind of a bit odd, but you've got to figure out ways to hold the hands of those governments in a way that actually gets them to address these problems by naming them for what they are. But it was not a conducive environment 12 months ago or even 3 years ago to really have those conversations. The thing I would say about what was so profound about that agreement was having the coalition of peaks at the table. I witnessed the change from a conversation between governments, and anyone who's been in the public service, actually in the public service, will kind of recognise some of this, of how it changed the conversation and how accountability was very different in the conversation. So prior to the first 18 months when I was working on that agreement, it was a conversation between governments, and it was a Commonwealth against state governments, basically. We would never kind of frame it like that, but that's how it kind of rolled. With the coalition of peaks at the tables, it shifted the accountability. It was not just government to government, but it was government to Indigenous non-government parties. And the quality of the agreement was profoundly better for that in terms of those conversations. And I'm pretty sure that racism wouldn't have gone on the table if it wasn't for the coalition of the peaks, because they're external parties. They're not beholden to governments, they're really beholden and accountable to the communities in which they serve. So I think that is a really important question, and it's an issue about how you drive change. You've got to share decision making. You've got to create mechanisms where non-government parties, in this case, can actually have a seat at the table and actually be a decision maker and actually sign off on the subsequent agreement.
Ray, I guess somewhat along those lines, another question's come through: how can government organisations better align data collection strategies with Aboriginal and Torres Strait Islander health and wellbeing priorities, which is something that you touched on?
Well, I think Ian sort of mentioned a couple of ideas around that. So when we've got strong relationships, as the Mike Y study, we're a research group, but we're very much focused on community-controlled kind of organisations and institutions that we work to. And so, like the data that we produce, those organisations like the Coalition of Peaks, like the National Health Leadership Forum, like NACHO, like those other organisations, when they've got a seat at the table with government institutions, they can use our data. So, that's the way we've sort of set ourselves up. We also then go and talk to government agencies. We get a lot of requests now. Even the presentation, bits of the presentation that I've done today, I've given that at some of the federal government departments. And now, after a bit of a rant I had in Adelaide with all the different health departments across the country, they're all now calling to say, can you come and do the same seminar to us to talk about the impact? So, today is an event. There's been a lot of work in the background in terms of government, in terms of working with our peak institutions and providing a service. And we were absolutely determined in the development of MyQI. We're driving the agenda, like get out of our way. And if you won't ask about racism and you won't collect data on racism, we'll do it for you and we'll shame you into taking this up.
I think it's fair to say great news that they've come to you. It's a shame that it took you having a rant, in your words, to shame them into it. And I think that goes to some of the broader challenges around having this conversation. Mabel, what have you learned from this process about being what Janine described as being a decolonised publication? And what do you think the Lancet needs to do going forward?
Thanks. The first thing to say is that I don't think we're fully decolonised. I think we're decolonising. And, as I've already said and as others have said, this is very much really almost not quite the absolute start, but near the start of it. I think there are four things we're trying to do here at the journal. The first thing is that we really want to listen. We want to listen to people from these populations, these peoples, these communities, and we're doing that in our part by listening to authors, having, as I mentioned, research papers and other sorts of papers that are Indigenous or minority group-led, particularly when they're about those groups. We deliberately seek out reviewers from those backgrounds. We involve our advisory board members. People like Ian have been very instrumental in helping us shape the content of our issue, our series. Then there's the truth-telling bit, and it's not us doing the truth-telling, it's you guys doing the truth-telling through your data, through the commentary that you provide, and through that, the advocacy that we can help to amplify. We also want this to celebrate, and I've learned a lot about how important, that was echoed also through the video as well as through what people have said, Uncle Wally and others, how integral culture and knowledge are to well-being, not just health but well-being, and that takes it up to a different level. And of course we want to advocate for change, we want action. So I think, those four aspects are things that we're very, very keen to continue working on, and I'm hoping that this will be a bit of a launch pad for us to keep talking to people here and outside.
Thanks, Mabel. I think there are lots of black academics that you'll be able to connect through to that Janine was mentioning. I tell you what, with this panel, I want to sit here and keep asking questions all day. We are over time, but I think on indulgence, I'll go and ask one more that's come through and got lots of thumbs up. And it goes to something, Peter, you were touching on about structural racism. Tom, I want to start with you and then open it and see if anyone else wants to weigh in. What opportunity do you think that the voice in the referendum could provide for addressing that structural racism?
Yeah, good question. But before I go on to do that, I just want to clarify a couple of things. One is the Close the Gap is a people's movement campaign of Indigenous-led with non-Indigenous people behind it to advocate and to try and press for reform. Closing the Gap is the government's response, and the Close the Gap is a human rights-based approach. Closing the Gap is not necessarily a human rights-based approach, although there are elements of human rights in there. And so, we shouldn't confuse them. Close the Gap, for example, has been going since March 2006, and it's taken quite a while for governments to come on board. We had a very significant report called My Life, My Lead in December 2017 that looked at social and cultural determinants of health. And I must say that health has led the way in this area. And that was one of the few reports, and probably the most significant report, that addressed racism. And it was a report to government. They sat on it for quite a while because of the racism reference in there. But at the end, they released the report unredacted. And so that was really the beginning of a process that led to some of the other reforms that have taken place, particularly around the inclusion of social and cultural determinants in the National Aboriginal and Torres Strait Islander Health Plan, and it's very significantly referenced in there. And that again was a part of a co-design process led by Aboriginal people. Donna Murray was the chair of that group, and it included both government and non-government parties to look at a health plan for 2021 to 2031. And so, they're really useful references. So where does the voice come in? Well, I think two things to think about. One is, at the time of the apology, the national apology in 2008, it was a bit of a renaissance in Australia where people started to think about and understand a little bit more about Aboriginal and Torres Strait Islander people and the impacts of colonisation, of government policies on us. And at the time, and this is back 2008, the rhetoric was all about, let's include Aboriginal and Torres Strait Islander people. It took quite a while to get to the position where we're at now, where we're looking at a referendum to present a voice to Parliament. And I think this is going to be another situation in the lead up to the referendum where people are going to start to talk and understand a lot more about Aboriginal and Torres Strait Islander people. So it's not as if nothing's happening, it's all happening. But, as I mentioned earlier, the interpersonal relation, racism and discrimination will come from us as individuals and the way that we address other people and the respect that we show, the inclusiveness we show for other people. But the voice will be about structural change, and it's about a direction to give a voice to the Commonwealth Parliament that's enshrined in the Australian Constitution. So it's only about Commonwealth legislation at this stage. But if we look at the work that's already happened on the co-design process, and co-design is really about the people working with governments, and for us as Aboriginal and Torres Strait Islander people, we're not the passive recipients of government policy. We're now the active participants in determining what government policies and programs, legislation will be into the future. So it's really turning it around a lot more. So not a silver bullet, it's going to be something that's going to take some time to really embed, but you've got the process leading up to the referendum, and I hope everybody here understands that you have a very significant role to vote yes in that, and then the significant role to talk to your families and friends and workplaces about why it's necessary to vote yes. And then we'll see opportunities for structural change, both at the Commonwealth level, and it'll flow down to the state and territory government level, where a lot of the activity in Indigenous affairs happens. And so, we'll be able to have a say on all those policy, all the bills, the legislation that goes through that impacts on us as Aboriginal and Torres Strait Islander people, and that's why it is so important to get this up, and so that we can become active participants. We'll complement what's happening through the national agreement on closing the gap, but that's about community controlled. There's about 50% of the Aboriginal and Torres Strait Islander population who aren't engaged in community controlled activities or organisations who still need to have a voice. So this is a very inclusive process, and hopefully we'll all be very positively disposed to voting yes.
Thanks, Tom. I might just see if there are brief closing remarks from the rest of the panel, Fiona.
Just a quick, just thank you for mentioning the apology. It's 15 years this next February since that apology. And as much as governments would like to celebrate, it's absolutely not a day to celebrate. There's too much loss, grief and trauma. Our young people put out a statement on the 26th of May this year saying that we're not counting anniversaries anymore, we're counting action. So we're going to elevate their voices again on the 12th. We're going to have a little activity, so stay on the lookout for more details about that. Having survivors come and listen to people tell them what those actions are that are going to actually respond to the unmet need of trauma and healing for survivors. Thanks.
Thanks, Fiona. Peter?
I agree with Tom. It's not a panacea for solve anything really. It's an investment, to go to Ray's point about the fact that we have a role to play. So it's an investment in us owning the risk across the board. It will bring greater accountability in terms of the structural issues in respect to the challenges of dealing with issues like closing the gap. For every dollar that leaves Canberra, less than 30 cents of that actually reaches projects or communities on the ground. So it's a convoluted nature of federation. That's a structural issue. So it won't do that, but this is the irony of it all in terms of the opposition to it, is that basically what they're arguing against is what will deliver what they're actually wanting to happen. So it's based on racism. It's not based on logic or reason about why there shouldn't be support for the vote. The vote to not support it, the anti-vote, is based on racism. Because if they understood the nature of the evidence and the factual-based propositions of reform and change, then clearly the Voice offers a real opportunity for the first time ever, potentially, in respect to addressing the structural issues.
Thanks, Peter. Mabel?
I guess I'd just like to say what a privilege it is to be walking alongside everyone here and to be part of the healing process. I don't think I can say any more than that.
Thank you. Ian?
I want to just say Mabel's right. The Lancet isn't decolonised, it is decolonising. And I want to respectfully encourage the journal to go further. Just to comment on constitutional reform and the referendum, it is a anti-racism measure. It completes the journey. There were two clauses in the 1901 Constitution that anchored that Constitution as fundamentally a racist document that excluded Aboriginal people from participating in the Commonwealth. 1967 took those clauses away. What we're proposing will continue that journey. There's no protection in the Constitution from a Commonwealth government doing racist things, but a voice is one mechanism to enable that. So I think that's the kind of way I see this in terms of the arc of history. And again, it is such an important reform.
Thanks, Ian, and I'll give Ray the final word.
I'll try to be quick. For me, it's a structural reform. So any structural reform is really good because it will have those additional effects at state and territory level and some other ways as well. The one thing I would be mindful though of is, our recent experience, not with a referendum, but with a postal vote, is we've been talking about high levels of distress. So there is a large potential in this debate for that to be elevated even further, and that would be really harmful. So again, just urging my support for a structural reform, but we need to do this in a respectful way. I know there will be people that won't be respectful. So I guess along with the debate and the discussion, and hopefully a yes, there will be support for mob along the way, because we're going to need it.
Yeah, thank you. And I think to reiterate that point, language is going to be really crucial in this next 12 months, and I think that's everyone's responsibility, including in the media and the commentariat as well. Thank you so very much to Professor Tom Calma, AO, Fiona Cornforth, Professor Peter Yu, who has had to just leave to jump on a flight, Professor Ray Lovett, Professor Ian Anderson and Dr Mabel Chu. Please give them all a round of applause. And thank you so much for all of the questions, and apologies that we couldn't get there, which I suspected was always going to happen with this panel and all the incredible questions. You can stick around. We're going to have refreshments in the foyer at 12:30, and please do pick up a copy of the Checkup on your way out. There are also a number of copies of the Lancet special issue available. Limited though, they're only 90. It's also freely available online, and there's a QR code as well. Thank you so much for your company today and for being part of this next step of the conversation of the work of Mai Kauai. Thanks very much, everyone.